We are here today to announce the presence of the first case of coronavirus disease confirmed in Nigeria. We are taking this step in order to give the clear facts to the public, which we hope you will all report accurately and be one step ahead of rumors and speculations and fabrications that tend to occupy the space, particularly the social media space at this time. And the case is that the Federal Ministry of Health has confirmed a coronavirus disease case in Lagos, Nigeria, known as COVID-19. The case was confirmed on the 27th of February 2020 and is the first to be reported in Nigeria since the beginning of the outbreak in China in January 2020. It is an Italian citizen who works in Nigeria and returned from Milan, Italy to Lagos, Nigeria on the 25th of February 2020. He actually landed here in the evening of the 24th, but by the time he got into his residence, Lagos, already 25th. It was confirmed by the virology laboratory of the Lagos University Teaching Hospital, which is a part of the laboratory network of the Nigeria Center for Disease Control. The patient is clinically stable with no serious symptoms and is being managed at the Infectious Disease Hospital in Yaba, Lagos. The government of Nigeria, through the Federal Ministry of Health, has been strengthening measures to ensure an outbreak in Nigeria is controlled and contained quickly. The multi-sectoral coronavirus preparedness group, led by the Nigeria Center for Disease Control, has immediately activated its National Emergency Operations Center and will work closely with Lagos State Health Authorities, or let us say is already working closely with Lagos State Health Authorities to respond to this case and implement firm control measures. I wish to assure all Nigerians that we have been beefing up our preparedness and capabilities since the first confirmation of cases in China, and we will use all measures and resources made available by the government to respond to this case. We have started working to identify all the contacts of the patient since he entered Nigeria, and even those who were with him on the aircraft. We have been in touch with the aircraft authority, the aircraft owners, to find out who his seatmates were. Please be reminded that most people who become infected may experience only mild illness and recover easily, but it can be more severe in other people, particularly those who are elderly and those who have other underlying chronic diseases. All Nigerians should therefore take care of their own health and maintain hand and respiratory hygiene to protect themselves, protect their families and others, following the precautions which I give you below. First, regularly and thoroughly wash your hands with soap and water and use alcohol-based hand sanitizer. Secondly, maintain at least 1.5 meters, about 5 feet distance between yourself and anyone who is coughing or sneezing. Persons with persistent cough or sneezing should stay at home and keep away from crowd, should not mix around in crowd, and should keep what we call a social distance. Make sure you and people around you follow hygiene, meaning that you cover your mouth and nose with a handkerchief or tissue, or if you have none of these, sneeze or cough into the sleeve at the bent elbow, or use a tissue when you cough and sneeze, and dispose of these immediately. Stay home if you feel unwell with symptoms like fever, cough, and difficulty in breathing, and catarrh, and call NCDC, which is available day and night. That is Nigeria Center for Disease Control. And the number is 0809 and 70000010. It has been given before. Please do not engage in prolonged self-medication. Stay informed on the latest development about COVID-19 through official channels on TV and radio, including Lagos State Ministry of Health, NCDC, and Federal Ministry of Health. Citizens must not abuse social media and indulge in spreading misinformation and false rumors that cause fear and panic. The Federal Ministry of Health, through the Nigeria Center for Disease Control, will continue to provide updates and will initiate all measures required to prevent the spread of any outbreak in Nigeria. Thank you very much. That is the brief. We are going to welcome questions. Definitely be advising their people to be echoing and reinforcing this information, because as a leader, definitely you don't want your people to get sick. And if you hear of this kind of advisory, I'm sure they all call their congregation and advise them to follow the guidelines that are being given. So that is already taken as a given, which I believe that all leaders and political leaders too will inform and advise their communities in that way. Now, as for the question about the flight, we are working with the airline. We are developing, we are going to get a manifest and then do a contact tracing and find all the people who are there. Usually you get their numbers and their addresses and monitor them. We're not going to assume that all of them are sick or will fall sick, but and advise anyone who has any symptoms to report and be monitored and be checked. So we have enough reagents to do the checking now. There are 4 laboratories in Nigeria that can test for this particular virus. 4 are able to test for it. We also have a system for sample transport. So a sample can be taken from somewhere and transported to a testing center within a few hours. So that is part of the network that we have prepared. Now, as for the lockdown of the city, there is no need for that at the moment. We have just seen this case yesterday and observing very closely as we kept under full isolation and is being given necessary treatment. And we're doing a contact tracing, watching to see who or how many people may have been affected, which we do not know yet. So we do not want to overreact. We know at this stage a little bit more about the coronavirus than China knew at the day it broke out, because that's the first day it came out in China. They themselves were in the dark. They didn't quite know what it was. But in the meantime, we have gathered enough information to be able to respond in a more structured way. So in China, of course, they have to do a lot of things very drastically in order to save the situation. We are going to see what measures we are taking. We are a secondary infected country. If you look at other countries in Europe, in Belgium, for example, I've read they had 1 or 2 index cases, and since then they have not seen any. So it doesn't mean that you will see many after this one. So Belgium has not seen any since then, and they are watching to see what happens without taking any drastic measures. As for smugglers, well, we have already done a risk assessment. And our risk assessment is that anybody, we know that this outbreak started in China. We know that it has spread to other countries, particularly in Europe and Middle East. We know that. So we know that if it's going to enter this country, it has to come from any one of these. It's not somebody who is trekking into Nigeria, because the person has to come in and he has to fly in, most likely. Now, if he's to come by boat, he can come by ship, but the ship journey usually takes about 2 weeks or 3 weeks. And the incubation period of 2 weeks, he will fall sick and will be noticed on the ship. So the possibility of anybody sneaking in by ship is very remote. Even those who fly into Douala, and even if they are smugglers, before they gather their goods and start preparing for the journey, 14 days will be over, they will fall sick because the incubation will show. So the process, and before they cross the border, the process for them is longer. So the likelihood is less. We're not removing the likelihood or the possibility. But if you are preparing for a challenge, you must know where the challenge is going to come from and focus your energy there and not focus it where it is less likely. So the land crossing, yes, is possible, but not so likely now. And the entry of this case now, and also the entry of the man who brought Ebola, shows quite clearly that such things usually go by air travel. As you know, this case also reached the United States of America, the coronavirus. It had to have gone by air. It couldn't have gone by ship. So we are looking at that point of entry as the most critical, and not ignoring the others because they are less likely because of the longer journey and the fact that the symptoms will break out during that long journey and the person will be incapacitated and will not travel further. But even if they come in, they will be noticed and found to be sick. So that's why we are prioritizing like that. And that should take care of the smugglers. So I think that that's all. We have answered most of